Good evening, I'm Lucy Van Olden-Barneveld, and this is CBC Ottawa News. We begin tonight again in Nova Scotia. RCMP now confirm at least 22 people are dead. These are the victims of the deadly rampage over the weekend. With the suspect dead and no note left behind, investigators are searching for clues in 16 different crime scenes. Families and communities are left devastated, of course, and they must now also grieve in isolation. Simon Dingley reports.
Saying farewell. Jolene Oliver, Aaron Tuck, and their daughter Emily's images are now stuck on a pole on a road. But this isn't just any road. The gunman lived here. His rampage began here. Among his victims, teacher Lisa McCulley. McCulley's sister is baffled a neighbor her sister trusted could have committed one of the deadliest mass killings in Canadian history.
He was always very helpful. They were acquaintances, so he would help her if she had any issues, and he was always very generous.
I guess this individual had a number of properties in Port-au-Pic. What was the relationship with neighbors? What about the relationship that he had with the people that he approached on Saturday night?
Little is publicly known about the gunman who was shot and killed by police Sunday morning. He owned this denture-fitting business in Dartmouth, and he left no note.
A lot of people are asking why this senseless act. Looking at the gunman, the RCMP will obviously take a deep dive into his online history.
Military vehicles were seen traveling down Port-au-Pic Beach Road today, an area where the suspect had multiple homes. An excavator was also spotted. They're typically used to dig up properties. The RCMP confirmed they will also be searching his properties. The Mounties say he was driving a very real look-alike RCMP vehicle, and they confirm he was wearing an authentic RCMP uniform. They did not say where it came from. At this point, there are far more questions than answers, and it may take months to piece together why he did it. Simon Dingley, CBC News.
To the pandemic now, and of course one of the big stories in this whole COVID-19 crisis has been the devastation in our long-term care homes. So with that in mind, let's take a look at today's numbers. Starting here in Ottawa, 42 new cases of confirmed COVID-19 reported here in this city for a total of 899 cases. Almost a quarter of these cases, or 226, are in long-term care homes. There are 25 deaths in Ottawa, with 14, more than half of those, in long-term care homes. In the province of Ontario, 551 new confirmed cases today for a total of 11,735. This province has seen 675 deaths. Meanwhile, Ontario has now made big changes to how it deals with the dead in the midst of this coronavirus outbreak. As Hilary Johnstone reports now, that means that families have to make tough decisions for their families quickly.
When someone dies in an Ontario hospital, their families are usually given time to make decisions about funeral details. But now they'll be given 1 hour to make that decision, and up to 3 hours if the person dies in a long-term care home. This change applies to most deaths in Ontario and not just ones related to COVID-19. Some exceptions include victims of possible homicides or car crashes.
I really feel sad because there's so much expectation that will be put on the families to make decisions promptly at a time of significant loss and grief. And it's really unfortunate that this is what's occurring.
The province's chief coroner says it's expected the number of COVID-19 deaths could put a strain on hospital morgues and long-term care homes. He says they are implementing a number of measures to get bodies into funeral homes more quickly since they have a greater capacity in their morgues.
It's to provide a prompt process of people being transferred into the care of those who are experts of providing aftercare.
Officials in the funeral industry say the new measures will spare Ontario of the scenes that have been playing out around the world.
Because that's happening, we are not going to see the scenes that we've seen in Italy or in the United States and other parts of the world where loved ones, the bodies of loved ones are in essence being stockpiled in arenas and community centers.
Besides time limits for families, the province is also switching to electronic death certificates. There are also changes to how bodies are collected by funeral homes.
They don't want us in the hospital interacting with the people, or usually you had to go quite a way into the hospital to get some of this information, the medical and whatnot. So now they will bring the remains to us at a door.
Ontario's chief coroner says he hopes these changes won't be permanent because of efforts to flatten the curve. Hilary Johnstone, CBC News, Ottawa.
Now, before lifting emergency restrictions,
paradoxically, we're going to actually start to increase the amount of testing we do.
That's because the province must be able to spot any spike in new infections quickly. The ideal system? What's called surveillance, widespread random testing of the general public.
I will be very pleased if when the economy opens back up and people go shopping at Walmart, they find someone outside Walmart who says, would you mind if we took a swab from you or a saliva sample from you?
Number 3, outbreaks in institutions, especially long-term care, must be contained.
Right now, our testing is very much focused in the long-term care and retirement home and probably other congregate settings.
When could this all happen? While officials won't commit to a date, here's one expert's prediction.
And I suspect that we'll be able to do some sort of relaxation of the restrictions in mid-May.
Whenever things do start to change, it looks like the first workplaces that reopen will be outdoors.
Certain areas that you don't have to worry about working side by side on a line that you can't practice social distancing, maybe outdoor activities.
Premier Doug Ford says his framework for restarting the economy will be released in a few days. Mike Crawley, CBC News, Toronto.
We turn now to Nova Scotia. RCMP now confirmed there are at least 22 victims of the deadly rampage over the weekend. With the suspect dead and no note to explain his motive, investigators are searching for clues from 16 different crime scenes. Families and communities are left with questions as they grieve in isolation. Simon Dingley.
Saying farewell. Jolene Oliver, Aaron Tuck, and their daughter Emily's images are now stuck on a pole on a road. But this isn't just any road. The gunman lived here. His rampage began here. Among his victims, teacher Lisa McCulley. McCulley's sister is baffled a neighbor her sister trusted could have committed one of the deadliest mass killings in Canadian history.
He was always very helpful. They were acquaintances, so he would help her if she had any issues, and he was always very generous.
I guess this individual had a number of properties in Port-au-Pic. What was the relationship with neighbors? What about the relationship that he had with the people that he approached on Saturday night?
Little is publicly known about the gunman who was shot and killed by police Sunday morning. He owned this denture-fitting business in Dartmouth, and he left no note.
A lot of people are asking why this senseless act. Looking at the gunman, the RCMP will obviously take a deep dive into his online history.
Military vehicles were seen traveling down Port-au-Pic Beach Road today, an area where the suspect had multiple homes. An excavator was also spotted. They're typically used to dig up properties. The RCMP confirmed they will also be searching his properties. The Mounties say he was driving a very real look-alike RCMP vehicle, and they confirm he was wearing an authentic RCMP uniform. They did not say where it came from. At this point, there are far more questions than answers, and it may take months to piece together why he did it. Simon Dingley, CBC News.
People in Windsor, Essex are grieving this tragedy as well in their own way. A retired RCMP officer who used to work in Nova Scotia set up a tribute on his own front lawn.
It's senseless killings. But, my heart goes out for the people in Nova Scotia, and my heart's still there in Truro.
You can see that he's used his uniform, boots, and hat in this tribute. Displays a broken heart that has come to symbolize the grief of his former home. Before the COVID-19 pandemic started, a CBC News series looked at the crisis of intimate partner violence in Canada and what could be done to end it. We bring you now part of that series, a look at how to get through to abusers, who are mostly men, Amy Dodge has more on programs doing just that here in Windsor and how effective they are.
When this 58-year-old man pleaded guilty to assaulting his girlfriend, part of his sentence was to enroll in the Partner Assault Response Program, and he definitely didn't think he belonged there.
The hell did I do? You know, it wasn't just my fault.
CBC is not identifying this man because he fears it might jeopardize his employment. The program is run by Family Services Windsor Essex. In the past year, 374 people have gone through the program. While most are men, about 5% are women.
I'd probably say the majority would rather not be there. Absolutely.
Some go through the program more than once, but when the information clicks, Barris says people do change. He says he notices it mostly in how they view their own behavior.
Not all, but most. I would say most I see a change in them. Okay. Some there's no change, but that's very few and far between them.
For this man, that change came when he started to see his childhood trauma differently.
What you did is you, regardless if you were under the influence of anything or not. That motion that you made was your motion. I said, regardless of how you look at it as, oh, she made me do it. No, you did it. So, oh, if she wouldn't, no, you should have thought about that. But I didn't have none of those.
Family Services says people who come to the program have had a lifetime of complicated traumas, mental health issues, or substance abuse. The program is only 12 weeks, and those running it say that isn't long enough. Hiatus House offers a different program over a longer period of time. Fresh Start runs 8-week cycles, and men are encouraged to continue attending for a year or longer.
I'm very direct with the men, and I ask them questions like, have you been abusive in the last week in any way, shape, or form with your partner? And or have you been thinking of or considering harming yourself or someone else? I think those kinds of direct questions are really important.
Every 8th week, the women are invited to this session to evaluate how the men are doing. They're asked straight up if there have been any abuse in recent weeks. Right now, there are only 8 men taking part in Fresh Start. Compare that to 1994, when nearly 300 were receiving treatment. Hiatus House says funding cuts in 1995 are to blame for the drop in enrollment. Right now, sessions are on hold because of COVID-19, except for those already in the program. They have telephone counseling sessions for support in the meantime. Amy Dodge, CBC News, Lakeshore.
Now, right now, Hiatus House has seen a decline in women seeking shelter during the COVID-19 pandemic. They call it concerning. One of the reasons? They say women don't want to leave self-isolation. So the emergency shelters converted 2 floors of the facility into 4 isolated areas. It will now accept 4 high-risk women. Those women will stay in isolation for 14 days before being integrated with the rest of the shelter. Hiatus House says COVID puts women at a higher risk of abuse.
So during this crisis, when we're asking people to stay home and be isolated, it increases her risk significantly, especially if her and her partner are there together. She may be unable to get to a phone to call for help. So we really ask that if you know that one of your neighbors is potentially in an abusive relationship, and you hear something, that you call the police to intervene and make sure everybody's safe.
Research is well underway in Windsor, Essex that could help in some key COVID-19 areas. Dozens of researchers are looking into things like our local PPE supply chain and other studies gauging the psychological impact the pandemic has had on healthcare workers and Windsor, Essex specifically. This is all under the We Spark umbrella. It's a local health institute that's combined Windsor's University, college, and hospitals. The executive director is Lisa Porter, and she walked me through some of their work this afternoon.
We have a lot of people in psychology, so with their research expertise in psychology, asking, what is the effects of this pandemic on children in our community, on our healthcare workers, on our healthcare workers' families. So they're asking a host of different questions, and not just asking the questions, but also really offering services. And so during their research, they're actually helping the people in our community. We also have researchers, even like myself, who have wet labs and do things called PCR. That's one of the things that I do in my lab, where we can take our expertise and aid in screening. And so improving screening times, getting results back to our clinicians. And of course, one of the big things that we're all worried about here in Canada is the border. And, so what's going to happen here in Windsor if the border opens up? And I think one of the best things that we could do is to have rapid screening protocols where we could be screening people as they come across the border, for example, or that want to travel.
Why is it so important for us to be doing this locally if the work's being done in a place like Ottawa or in a place like, somewhere in New Brunswick?
Research is a very finicky thing. So if you're not looking at the right populations of people, often, maybe the interests of that group are left out. And so one of the really important things is if the research questions are being driven from us here, we're making sure that our population demographics are what's being considered.
Mayor Drew Dilkens says that he is in talks with the medical officer of health over the possibility of reinstating bus service here in the city. But so far, he is showing no sign of bringing it back before the May 1st deadline. Meanwhile, people and agencies in the city are finding different ways to cope without public transit. Dale Molnar has more.
Mayor Drew Dilkens suspended bus service last month in order to slow the spread of COVID-19. The move sparked an outcry from several users. Ethan Lazard works in Oldcastle. Usually he relies on transit, and it's been hard without it.
It's a physical job, you're exerting yourself, and then it's a 10-hour shift, and then on top of that, you're walking 2 hours home and 2 hours back. So it just makes for like an expensive day, a long day, and a tiring day.
So Lazard is now looking at buying a car. But what about those who can't afford one? Many people relied on transit to get to food banks, like the one at the downtown Mission. The executive director says they've begun home delivery to help those who aren't able to get there.
Once the buses stopped, that created a bit of a challenge for those that rely on public transportation. So our volunteers and our food bank staff are taking those calls through our distress line. So the increase is there for sure.
To look at just how challenging getting to a food bank might be for those who need it the most, a local software developer created this map, which indicates by color code where the quickest walks to food banks are. The light yellow areas indicate areas where it's about a 0 to 10 minute walk. Turns out people in low-income neighborhoods often tend to have the shortest walks to food banks.
The mayor says the bus service will return, quote, as soon as it's safe and practically makes sense. But so far, the deadline remains May 1st. Dale Molnar, CBC News, Windsor.
Look outside there, no snowflakes falling, but the winds today, they were something fierce. Colette Kennedy warned us about that, and now there's a flood warning. Flooding currently happening in places like Lighthouse Cove. We'll get an update on what to expect after the break. And joining us now for a live look at the weather is Colette Kennedy. Colette, you were telling us about those winds yesterday. I know the snowflakes are the things we joke about, but the winds are what causes that flooding that we're seeing in Lighthouse Cove. Is there any easing up coming our way?
Yeah, there is going to be some easing up. So we've got a few hours yet into the evening. Gets a little bit better, Chris, overnight, and then much better through the day tomorrow. So let me kind of walk you through. First of all, I'll just show you what's happening with just the sustained winds, all right? Those coming in 40, close to it, over 40 kilometers an hour in Chatham-Kent. But Chatham-Kent, you've had a wind gust today close to 70, over 60. We've had some of the wind gusts today into Windsor. And as we look at the forecast now of what's going to be happening, so still gusts over 50 kilometers an hour as we go into the evening hours. Then through the overnight, you can see the gusts are around 30 to 40, and then coming down further and non-existent, really. Not anything too tricky to deal with through the day tomorrow. And I really like to see that, of course, because that will help with the areas where we just get pounded when we see those winds along the shores and in the flooding areas. So our current temperature, obviously, way below seasonal. You know, it's only 4 degrees right now, -2 in terms of what it feels when we factor those winds in, and some of the lake effect being caught here on the radar as well, with some of those snow showers and bursts, more of those now over to the east of us, some rain showers that have been coming through our skies through the earlier part of the afternoon too. But as we broaden the perspective and I show you kind of what happens, we're still going to see those northwesterly winds to westerly in terms of directional. We will get some clearing to start the day off, and then clouds are going to be pulling in because another system is going to be clipping to the south of us as we go later Wednesday into Thursday. So rain showers turning into a bit of a mix and quite a bit of cloud cover that we're going to have to deal with too, all the way in through Thursday. So that is what's coming next. We'll get a little break in between, -3 overnight for our temperatures, but feeling more like -8 to -10 in some cases. Tomorrow afternoon, 6 degrees with that cloud cover really pulling in here, but Thursday, I know the rain showers come in, but hey, 9 degrees. Friday, 13. It's more like it. 12 degrees Saturday. We've got a few days yet where we're going to see that precipitation coming at us, but we'll get those temperatures up and the winds back.
Okay, thanks, Colette.
You're welcome.
Coming up, we're going to have a story about a Windsorite who has managed to make it back home from Peru. U.S. President Donald Trump wants to suspend all immigration into the United States over COVID-19. Trump announced his intention on Twitter. Quote, in light of the attack from the invisible enemy, as well as the need to protect the jobs of our great American citizens, I'll be signing an executive order to temporarily suspend immigration into the United States. No word yet on when Trump will sign the executive order. After more than 35 days in Peru, a Windsor man is back home. He was sent there for work, arriving just before the country instituted a strict quarantine. He was stuck in his hostel for more than a month. He says it was scary, especially with 2 COVID-19 cases at that hostel.
The biggest stressor of the situation was just not having any information. It's a very different style of government down there. It's a very different country. And just trying to understand the situation and understanding the consequences and doing what's in our best personal interest, especially for our health, and not having any control over the situation, that was definitely a struggle.
Relief finally came a few days ago when a German repatriation flight became available out of the city he was staying in. He boarded a flight from there to Lima to Germany, and from there finally landing in Toronto yesterday afternoon, feeling happy and healthy.
It was pretty cool to be on that flight with 40 people, mostly Europeans, and just when we landed, and I've got pictures of us just like applauding and just being so thankful. It's a real privilege to be home.
Now that he's home, he'll be in quarantine for the next 2 weeks. He said if he wasn't able to get on this flight, he may have had to remain in Peru until the country reopened its commercial flights. It's unknown when exactly that would have happened. Now, these are tough times for a lot of people, but mantras can help people get through that. We want to know what words of comfort you think of when coping with COVID-19. Keep calm, carry on, one day at a time, stay home, stay safe. Share them with us. Call our talkback line 519-255-3400 or send a video to community@cbc.ca. It's 6:29 p.m. and that's it for us here. Thanks for watching. Make sure you enjoy the rest of your evening and stay safe.